I'm Martin Roland and I've been Chairman of the Commission on the Future Primary Care Workforce. I'm Professor of Health Services Research in Cambridge and I've been a GP for 35 years. Primary care in the NHS is in many ways is the jewel in our crown. It's emulated in many other countries in other parts of the world. However, it is really under strain now with an increasing workload, an increasing difficulty in providing the sort of care that patients need. So this commission was set up to look at models of care that would provide for the needs of the NHS in future. The commission is quite small. There are 6 members of the commission, myself with a background in general practice, and other members of the commission with backgrounds in general practice, in pharmacy and in nursing. We've had over 200 submissions of written evidence from a wide range of both professional and patient organisations. Then we've also taken oral evidence from, again, both patient and professional organisations, and we've carried out a number of site visits going to interesting and innovative places around the country. This report is not suggesting anything that is revolutionary. We're very much suggesting evolution of primary care into the new forms of care that we need to see. So the challenges which primary care faces that we've got to address are first of all the increasing expectations of what primary care can actually deliver, and that's both in terms of care moving progressively out of hospital, including under some of the new models of care outlined in the 5-year forward view, but also some very real problems in providing the workforce to address those needs that patients have. And we know that there are very substantial problems of recruitment into general practice, vacancies both in training places and also in GP places themselves. And we also know there are similar problems of recruitment to general practice nursing. So we've got this twin problem of increasing need and a workforce that is really struggling to meet that need at the moment. Well, the solutions come in a number of areas. First of all, there need to be sufficient staff to meet the needs of patients, and we've pointed to the needs for additional GPs and additional nurses. But also we're looking very much at a broader range of professionals being involved in delivering primary care to patients, particularly in general practices. So we've looked, for example, at the increasing role that pharmacists could play in general practices and with GPs, and other new types of workers such as physician associates, who could be seeing many of the patients who currently see GPs. At the moment, GPs find it quite difficult to communicate with specialists. A patient might come in to see a GP with a query about whether their medication needs to be increased, and the GP needs specialist advice on that. And he may find that there's nothing he can do but send the patient back to an outpatient clinic. GPs don't have ready email access to interact with specialists for something that might be quite simply dealt with by an email exchange. We'd also like work to be done on emailing with patients. We know that that is something that the profession feels very nervous about in terms of the potential impact on their workload. But we think it's rather unlikely that in 5 or 10 years' time the only person in the world you can't email is your GP. We have found a number of opportunities for providing better integrated care, and we're particularly concerned where there are large aspects of care that are provided by organisations that are not well integrated or linked up to current primary care providers. And 2 examples of those would be out-of-hours care and community nursing services. And what we have recommended is that when contracts are let for those types of service in future, that one of the requirements for bidders that they should be able to demonstrate that they can integrate well with existing providers. Quality of care for the patient is, of course, has to be at the heart of what primary care provides and has been an important thing that we've looked at in this review. But one aspect of care that we've particularly picked up on, and we know is getting worse in the NHS at the moment, is people's ability to see a GP or a nurse of their choice. So our recommendation here is that along with other metrics, the ability of people to see a doctor or patient of their choice should be a key metric of NHS care. So we've made a number of recommendations that relate specifically to training. And one particular gap which we've identified is preparing people, doctors, nurses and managers, for roles in running and organising and managing the new types of organisation that we see within primary care. For example, GP federations and networks. The staff that we have working in primary care need to prepare to lead those organisations, and that's a very important thing for Health Education England to provide. We do think that these larger groupings will be needed for a number of reasons. First, to provide a wider range of services for patients that an individual practice couldn't contract for. Secondly, to relate to patient and local voluntary organisations much better. Again, there are many organisations which could help patients in a community that a single small practice just hasn't the means to know about, and we think that federations have a real opportunity here. Clearly the focus of this review has been on providing care for patients, but also it's very much been around care for professionals. Unless we look after the professionals who provide that care, we're never going to be in a position to really provide a top quality service. One of the things that we hope that our review will do is to make primary care the career of choice for a much wider range of young doctors, nurses, pharmacists and other health professionals. In the short term, we need other healthcare professionals simply to provide the volume of people that we need to provide the care that patients want. So what this means for patients is that in many instances we want patients to get what they're getting at the moment. So we want them to get a local service, we want them to get a service from a health professional who they know and trust, and we don't want that to change. On the other hand, we do want them to have access to a wider range of services in the community, and they will be seeing a broader range of health professionals who can potentially provide those services. One of the things that has really struck us as we've done this work have been the outstanding examples of good practice that we have seen. And one of the things we've thought about as we've done this review is how can the NHS be organised so actually that sort of care can be delivered in all practices. And we think there are some real opportunities to do that, both so that practices will be somewhere where health professionals really want to go and work and know they're providing a high standard of care to patients. When we are faced with constant crisis in the NHS, it's very difficult to step back and realise how highly the NHS is regarded by other countries, particularly primary care. And I think that we have the opportunity to continue to provide leadership and show the real place that primary care can play in a healthcare system.